Hello Toastmaster and dear guests. Let me take you to an Indian village. But how can you imagine an Indian village if you have not been to India? So imagine a Chinese village with brown people, with black hair and thick hair. So there was a lady who was in her 60s, very old, bent, and she could barely walk, very simple and humble, just used to do farming to win the livelihood. And she had a grandson who was like 3 years old, who was frequently ill with chest infections, coughing, getting treated, again get the disease because he had a heart problem. And to get him a normal life, his heart has to be fixed. And he needs a surgery for that. Very special kind of surgery done by specialist doctor in kids who operate only the hearts. And there was a doctor who was around 800 kilometers away from that village. And that was a very remote village. If you want to go there, you have to change 3 buses and it takes like 1 day. Wow. Or even more. It was hard for her because her son and daughter-in-law, they died in a natural disaster and she just had the son. So one day she decided to go to the town and get him treated. She sold some of her land, had good enough money. She reached the city. After arriving at the city, in the hospital campus, she has no idea where to go. So she had a paper where there was the name of the doctor and the hospital. So she asked someone, "Son, can you help me with this? Where can I find this doctor?" "Yes, aunt, you go straight, take right, and you'll find a big table. Just ask there. That's reception." So she walked straight, turned right, and went to the table and showed, "I want to see this doctor." "I'm sorry, he's not available for 1 month now. You have to come after 1 month." So she was shocked, devastated. She didn't know about this kind of system. So she was sad, turned around, went back to her village. This doctor's name was Dr. Frank, and he had to attend a very important conference a few days later, and he was on a flight. The flight was having very bad and severe turbulence. It was like shaking like this, going down, again going down, and shaking like this. And people were like almost chanting and praying like they're dead. And fortunately there was a small airport and the pilot did an emergency landing. And the doctor was told that the flight won't be taking off for next few hours. Maybe it will take off tomorrow because of the very bad weather and storm that was going on. So this guy, he was kind of main person who was hosting the conference, so he had to reach there. And he asked his assistants, "Can you tell me how far are we from here?" He said, we are around 400 kilometers. "And what about car? If we take a car, how long will it take?" The assistant said, "Maybe like 4 to 5-6 hours. I think we can reach." And the doctor said, "Okay, let's take a car and let's go to the conference." And they started the journey. After a few hundred kilometers, there was very severe storm and they could not continue. They had to stop, and they stopped. And they rushed in a nearby house just to take some shelter. So they knocked and the door was open and asked, "Yes, how can I help you?" "Madam, if you don't mind, can we stay here for a few hours because of the storm outside? We have our car here. If you want, we can pay you for that. That's not a problem." "You want to pay me? Oh, that's okay. You can come in and that's fine anyway." So the guys went in and she asked, "Do you need something, some water?" "No, we are good, thank you very much." And they were sitting. "Alright, so I have to take care of my kid, so if you need anything, let me know." And she goes to her kid. The kid was severely coughing. She gives him some medication, he was okay. And this doctor, he realized this cough was not like normal cough. There was something special about it, like a chronic cough, which has been lasting for years. And he asked and said, "So what happened to your kid?" Son, he is sick for many years now. Like when he was born, he had a heart problem, and he has been having fever and cough and ear infections every now and then. And his parents died in a natural disaster. So it's only me who is taking care of him and trying to get him treated. So he said, "Did you consult any doctor?" "Yes, I consulted so many, but the one who can help, he is not available. I went to the town and he was not here for next 1 month. So I have to wait and there is no choice." Okay, so what was the problem? So she brought all those reports and tested it, and he had a look. Okay, and which doctor you were looking for? And this lady said, wait a second. She doesn't know the name of the doctor. She took out the paper from the bed and she's like, "This is the doctor I'm looking for, but he is not available." And this he was like, "When did you go? Where did you go?" "I went to this place, it's very far, it took me 1 day and I was very tired. I did not know the rules of the city, I had to wait for 1 month. They asked me to come again after 1 month to get the time to see the doctor." And this guy, he was so touched. He hold the lady and said, "I am the doctor. You don't have to worry. He is my son. I'll take care of it." So that's called destiny. It's just written. The guy who she was looking for came walking to his house and her problems were solved. So that was the kind of destiny I wanted to present, and this story was presented by the same doctor in our university and hospital. So it was really touching to know that. Thank you very much.
Thank you, Dr. Yes, it's very